Hi, I'm Art Caplan. I'm at the Division of Medical Ethics at the Grossman School of Medicine at NYU in New York City. ALS, horrible disease. We all know, some of us know it as Lou Gehrig disease, creeping paralysis, certain death, horrible disability, confinement to a wheelchair. Many people wind up only able to operate a computer screen to message. It is just a miserable, miserable disease. And people have been trying to find ways to intervene, to fix it, to cure it, to slow it. Unfortunately, some patients and families and some others believe that the biggest obstacle to getting an answer to ALS is the FDA and regulations. That regulations are causing bureaucrats to slow down potentially beneficial interventions, that regulations and the FDA are indifferent to the suffering of patients, paying more attention to data analysis, wondering more about the certainty with which a particular claimed cure or intervention really can help, not letting patients who are desperate make or take a risk-benefit choice given their dire straits, that they are willing to try things and to gamble that something might help. And even, as some patients say, if it kills them or they die more quickly, well, the disease is so bad that they would like to be able to make that choice. Legislation has been introduced in the House and the Senate called the Promising Pathway Act, basically pushed forward by ALS, not all organizations, but many of them, that would expedite review by the FDA. It says the FDA should establish a rolling real-time review, meaning taking a look every day, technically, at drugs that are intended to treat or prevent or diagnose life-threatening diseases. On this pathway, the FDA could grant a sort of limited approval, letting a drug that has some evidence of safety get out to the public and maybe has some promise that there's efficacy. But the way that would be determined is not by a clinical trial, not by a study, but basically by real-world evidence, including claims from patients, claims from family members that they feel better, they think they're doing better, that they think the drug that a company is trying to get approval to sell is really doing something. I think this is wrong, and it really is painful for me to say it, but I think the difficulty with fighting and finding help for those with ALS or preventing it is not the FDA. It's the science. We just don't understand this disease very well. The science just isn't in a position yet to say we're going to be able to offer some benefits. Various drugs have been brought forward, presented to the FDA. The experts have taken a look at them and they say they're just not convincing in terms of conveying any real benefit. Desperation, of course, makes people want to try anything, but it doesn't mean that the science that's out there supports it, nor does it mean that entrepreneurs and investors who want to sell things to ALS patients, who want to get the government to approve reimbursement for their drugs, are really telling us honestly what they are capable of doing. Sometimes even they work with patient groups to try to get them to agitate Congress or the FDA or both to provide approval so then they can get reimbursed. This is a tough area. There are a lot of little companies that if they don't get their drug approved for some use are not going to make it. The company won't survive. It doesn't have much money. There are other situations where patients are saying, don't protect us from harm. Don't protect us from a lack of efficacy. And there are still others saying, look, if you approve some of these drugs and the price tags are hundreds of thousands of dollars per patient or millions, you're going to wind up spending a fortune on something that may not work at all. So I don't think the time has come to pass the Promising Pathway Act, to try and have temporary approvals, less evidence, allow more sketchy claims to be put forward as a basis for a temporary approval of a drug. I think we still have to be tough and say, get drugs into controlled clinical trials, then use claims from patients, real-world evidence, to supplement what the data is in the trials. But there's no replacing clinical trials of drugs with patient stories, narratives built up by the company. That's just not the way to get the public interest served, the patient's interest served, at a time when the science is still tough, not there for cracking ALS. So it's sad to say it, but I wouldn't put my money into efforts to reduce the bureaucracy. I'd put my money into more research, more rapid research, bigger research projects. I'm Art Caplan at the Division of Medical Ethics at the NYU Grossman School of Medicine. Thank you for watching.